Assalamu alaikum, ladies and gentlemen. I am Mahwish and I am here to present you the welcoming of our today's Doctors Con. And I'm feeling really obliged and privileged to have all of you over here with us in our conference. And I really thank you that you have taken specially extreme precious time out of your busy schedules to join in today with all of us over here. And a special thanks for Brigadier Dr. Waqar Azim, Head of Pathology Department, CMH, and Mrs. Dr. Munira, Head of FJOG Association, and Dr. Tahir Munir, Orthopedic Surgeon from all the way from Gujranwala. He also joined in today. Dr. Noman, Administrator, PSRD Hospital, and Dr. Latif, Orthopedic Surgeon, PSRD Hospital. About KKT, I must tell that we have, till today, in just 1 year, we have successfully completed 5,500 treatments. And about our patients, we've got many of them who have been successfully treated from our treatment. And we've got a lot of testimonials given by them over here, which you might have seen downstairs on displayed in our reception area. And through those testimonials, we see the success stories of KKT. And I won't take more of your time. I would like to call upon Dr. Afzal Hussain, our Chief Orthopedic Surgeon. He would discuss all the technicalities, whatever he wants to, about our treatment.
Thank you for coming. And today my talk is for the first time in the since KKT has started. I'm talking purely technically and purely on scientific basis with pure references. You will see very less sentences brought from myself, but all the sentences that you'll see here belong to someone else, more experienced, and world-renowned studies will show you their comments about the. I have two segments of my talk. First segment belongs to the present status of the treatment that everyone is giving and its evidence, which is available in the literature. And the second talk, second half would be about KKT. My topic is, I have named it a mystery needs solution. You can see this, the point prevalence means that at every point of time, like it is now 3:10 and it is 26th of January, if you see the back pain patients suffering in the population today, it will be 25% of the population will be suffering from the backache at certain point of time. The second, in 1 year, you will find about 50% of the population will be suffering from some kind of backache. And in lifetime of a person, 85% of the population will be suffering from back pain. We should look at why this happens, why these figures are so high. The answer is simple. If we don't know the cause, we are not able to control it. Likewise, once we were not able to know the cause of poliomyelitis, we were not able to know the cause of malaria, and it was epidemic. Once we knew the cause, it is controlled. Why we have not controlled the back pain yet? Because we don't know the cause. And this is the problem, why I am calling it a mystery. With the present day technology, with the present day of modern investigative workup, still we don't know the exact cause of most of the patients suffering from the back pain. Now, if we look at the symptoms, most of the patient will be suffering from this area. There's a mild pain, occurs with some kind of activity and goes away without any treatment, just if the person avoids that activity, and usually patient does not seek for any treatment in this stage. Then there is a second stage of presentation. It is a frightening, severe disability, pain radiating the legs with some degree of numbness and weakness of the extremities, these are the patients who look for the care for the first time. Second, this is the area which is to be looked for. Researchers have established that although symptoms often do recede within a few months, currently low back pain can be considered a recurrent disorder that can occur at any time in a person's life and fluctuates between a status of no pain or mild pain or pain that reaches a point where it interferes with activities of normal living or become debilitating. This, you can see the reference below, and actually this is the area which we should concentrate. Everyone who is practicing looking at the patients with a back pain or a patient himself cannot deny this fact, that this is the fact. Most of the patients presenting with a mild pain at some stage of their life will be converted to the severe debilitating pain. So a point here I want to stress upon is that once you feel even a minor degree of pain, it should be taken carefully and you should be examined by a doctor, and you should try to make a diagnosis, as it should not proceed to the more debilitating or more disabling condition. Next. Now, how we will classify acute low back pain less than 6 weeks is called acute. If it is up to 3 months, it is subacute, and if it goes more than 3 months, then it is called as chronic. And for symptoms which are recurrent, which are most of these patients are recurrent, and sometimes acute, sometimes subacute, sometimes chronic, but the attacks keep on coming in and going off. So this we call as a recurrent, and I think the most of our patients belong to this area. Next. And this is the statement you should always look at very carefully. The perception that acute low back pain goes away rapidly without returning has been proven false. And the term chronic is often perceived as incurable rather than long-standing by the patient. Patient को सब्र आ जाता है मुख्तलिफ ट्रीटमेंट्स करने के बाद वो कहता है जनाब दवाई खाता रहता हूँ, ठीक नहीं खाता, फिर से बीमार, इसका कोई इलाज नहीं, तो उसको सब्र आ जाता है कि ये ऐसे ही चलना है. And there are many reasons I will discussing soon after this. And this is again a very reputed journal, Journal of Spine, reported in 2006. Next. So the problem lies here. Once we don't know the cause, we are not able to treat and we are not able to control any illness. One of the greatest mysteries surrounding common low back pain is epidemiological, anatomical, biomechanical, pathological studies into the etiology of common low back pain have yet to create a clear link between precise risk factors or specific tissue injuries and particularly symptoms. What happens when we don't know the exact cause? We just start defining different risk factors. The activities or the problems that we see in our patients presenting with back pain, we start calling them as risk factors. But looking at these risk factors, I am much confused, and I think all of those dealing with the back pain patients are confused. Let's see. Most of the problems where we don't know the cause or we are not able to establish a diagnosis on MRI or on X-rays, we label it is probably due to psychological factors. And I'm not sure yet. I think if anyone is sure about this fact, he should come up, that the anxiety came first or the pain came first. It is just like anda pehle tha ke murgi. This problem is not solved. This is yet a mystery. Then there are definition of different factors, risk factors, socio-demographic factors. They are unavoidable.